And ultimately, having worked with a number of individuals who both have diabetes, but also often elite athletes as well, what can be learned to optimize not just health, but also performance? Because there's a lot of things that can be leveraged if you know what you're doing.
And never disregard anecdote. I feel like, it's maybe to a certain degree you can disregard certain anecdote, but the reality is like your lived experience, someone that obviously has a lived experience where you're getting every single nook and cranny of data that you could possibly get. Yeah. That's a true lived experience. Really quickly, we don't have to do a deep dive on it, but have you noticed the effect of sunlight, even if you're like not active in the sunlight? Like if you just go and lay out in the sun for 30 minutes or 60 minutes, absent of maybe heat exposure with it, do you notice a change?
I have, but it's subtle. Mm-hmm. So this is giving personal. This isn't like a randomized control with 1,000 people. This is my lived experience. I have found that sunlight has a pretty important effect on overall insulin sensitivity, and I've actually kind of controlled this. And looked at days where I was inside more or went outside first thing in the morning, and have seen changes in insulin sensitivity within those days. I will also say that it's almost impossible to detangle whether that is a result of the benefits of what a lot of people now look at as this setting of your circadian clock, and then getting improvements of sleep over time and all these other variables. But I have seen that sunlight does have an effect, although it's incredibly subtle, independent of heat. Heat has a very powerful effect. Yeah. Anyone who has type 1 diabetes who's injected insulin and went into a very hot shower, a very hot bath, or a hot tub, and all of a sudden seen massive tanks in their blood, or sauna, and seen tanks in their blood glucose, post 15 minutes or so, that tells you something.
Just the stress response alone, but probably also the vasodilation, I'd imagine too.
I think it's much more to do with, so number one, you're injecting it peripherally. So it's also about the uptake into the bloodstream. And so the vasodilation, the increased blood flow, all these factors do play a role in the ability for insulin to be exposed to tissues. And the heat expedites that, right? You're moving insulin to these tissues much quicker when you're applying heat or increasing the blood to these peripheral tissues where insulin could be exposed, like muscle tissue or otherwise.